Okay, are you all excited? Okay, today we're going to talk about 4 important topics. The first one will be on fluids, electrolytes, acid-base disturbances, COPD, and then of course what? CRLD, right? So with regards to fluids and electrolytes, one of the things you will be doing as a future nurse is taking care of patients. And is it important to know that your patient is in fluid balance? Yes, because if a patient has fluid deficit, he could end up becoming dehydrated, and can he die? Of course, he could die because of dehydration, okay? So that's the reason why this chapter on fluids and electrolytes is important. And that's the reason why I said you have to be able to differentiate what is fluid volume overload and fluid volume deficit. They're the opposites, right? So what it simply means, therefore, is that you need to be able to differentiate one from the other. If I put the word fluid here, I can put the word what? Deficit, and I can put what here? Excess. Overload or excess. They mean the same thing. One of the things we normally do is that we tell the nurses to monitor urinary output and fluid intake. Fluid intake through the mouth per ORM or what? IV fluids, right? Or through the nasogastric tube, okay? And how do we measure fluid output? The primary source would be what? Urinary output, because there would also be what? Insensible water loss to sweating, and there's also some amount of water in the stool, but most likely the most amount of fluid coming out will be from the urinary output, right? You are fully aware of that. For it to be considered normal, what is the considered normal urine output per 1 hour? How many ml? How many ml of urine should you expect a patient to have? 30 ml. Who said 30 ml? The answer is right. Are you an LVN? I can tell, okay? You work in the hospital or nursing home? Most likely, yes. Why 30 ml per hour? That's universal. That's the number you need to memorize, right? Whether you're an LVN now or not, it doesn't matter to me. You're gonna be an RN. If the amount of urine is less than 30, let's say 20 ml per hour, is that normal? So let's say from 6 p.m. to 7 p.m., you have a patient with an indwelling catheter with a Euro bag, and you were told to monitor the output every 1 hour. It turned out to be only 20 ml from 6 p.m. to 7 p.m. Would you inform Dr. Gamo? Yes. Why? It's not normal, it is abnormal, it is less than 30. What do you call the condition? It is called oliguria, according to Tigran here. And what is oliguria, Tigran? Oliguria is what?
Low urine output.
Less than what?
Less than 30 milliliters.
So it is very numerical. We don't hear say low output. Measure it. I don't want to have a nurse who tells me, oh, patient is oliguric, and I ask the nurse, what's the output? 50 for 1 hour. My goodness. I'll probably have a heart attack, right? The definition is so strict in nursing and medicine. So we're dealing here with human lives. We cannot afford to make what? Mistakes, because people will die. Do you understand? Less than 30 ml. What about if it's 30 ml? Because the definition is less than 30 ml. If it's 30 or more, it's considered normal. But 30, you have to watch out. Okay, you may have bad eyesight. You know what I mean, okay? What about if it's zero output? Anuria. A or A means without. Oligo means scanty urinary output. Now the thing is this, what? So let's start with deficit. It's easy to remember deficit, right? How can you therefore lose water in your body?
Diarrhea.
Diarrhea. So what organ system is involved there? GIT? Diarrhea. That's very obvious. Why do you lose water in diarrhea?
There's not enough time to
Okay. If I were to answer that question, I would say the peristalsis is so fast Why is peristalsis so fast? Maybe there is a toxic substance in the food you ate that can food poisoning or you have infection. The endo or exotoxin causes increased peristalsis. And when there is increased peristalsis, which means the smooth muscle is contracting so fast, there is no time to reabsorb what? Where? In the large intestine. Remember? Cecum, ascending colon, transverse descending, sigmoid colon. In other words, because the water is not being reabsorbed, the water remains where? In the SHIT, which happens to be what? Stool, right? Okay? I'm forbidden to use that word, so that's why I just spell it. I'm taping it for posterity, okay? Water loss. What else from GI tract?
Emesis.
What is emesis? I like that term. Who used the word emesis? And what does emesis mean? A woman who is pregnant, suffering from hyperemesis gravidarum. What does hyper mean? Increased vomiting episodes because she is pregnant. Can she become dehydrated?
Yes.
Now, before I forget, our body is 66.6% water. And most of its water is found where? Inside the cell or outside the cell? Inside the cell. Why? Because who needs the water? Don't you like it? Don't you love anatomy and physiology? It's so amazing, right? It's just common sense. Who needs the water? The cell. So where do you find the water mostly found? Inside the cell. It's called the intracellular fluid compartment. A patient who is 100 pounds. So how many pounds of that would be water? 66 pounds. 66.66666 pounds. Oh my gosh. 6666. Okay. Joke only. Okay? In other words, if today I am 100 pounds and tomorrow I had diarrhea, I became 85 pounds, how much water did I lose in my stool? From 100 to 85. I lost how many pounds?
15.
Oh my God, so slow. Fast, my gosh. That it took you a few seconds, right? I'm just kidding. At least you're the first person to give me the answer. But it took you, I counted around 4 to 5 seconds, you know? 100 minus 85, 15! Why is it important you have to think fast and act fast? Because time is of the essence in nursing care. We can afford to be slow. A patient lost 15 pounds and this was accounted for by what? Water deficit, water loss, right? Okay. Emesis, the same thing. What else? How can you lose water? Where do you think is the most common source of water loss in these patients? I want you to think. Of course, you always want me to spoon feed you, but yes? 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 Say something. Huh? Why am I smiling at you, my friend? Of course. When you have increased water output from the urinary output, right? So that's going to be what system? Urinary system, right? And that is called what? Polyuria. Increased urine output. And therefore, what can lead to urine output increase? I gave you a list of disease conditions. Can you give me one of those lists that I gave? I think that I gave that A, B, C, D, E, F. Huh? Diabetes what? Mellitus. Very good. DM. The mechanism here is what? Does anybody know? Now, I do not have the time to discuss all of these, but the idea here is that you need to know how and why it is going to lead to water loss. All I know, I can give you this word of advice. Study the mechanism or pathogenesis. The answer to my question is called osmotic what? Diuresis. Why? Remember the word nephron? Remember the word nephron? Okay. Proximal tubule, the loop of Henle, the distal tubule. This is the Bowman's capsule. The Bowman's capsule is here. The glomerulus is there. And guess what? In patients with diabetes, there is hyper what? Glycemia. Increased blood sugar or glucose. The sugar here, can it go into the urine here?
Yes.
If there's a lot of sugar here, what will it do? Will it attract water? Remember osmosis? Water will move from high to low, high to low, high to low. This is the peritubular capillaries here. In other words, there will be more water to be sucked into what? the tubules of the nephron. And therefore, that's the reason why they have increased what? Urinary output as much as what? Normally, we have 1.5 to 1.8 liters per day of urine per day. In patients with polyuria, it could be as much as 3 liters to 4 liters a day. Yes, ma'am?
Is that the reason why their mouth is always dry, when they don't know they are...
Well, to some extent, because they could be dehydrated, as you can see. Right? Skin, turgor is affected. You go like this, it's what you call tenting. It tents. And then this poor skin turgor, right? Dry mouth because they're dehydrated. That's part of fluid deficit signs and symptoms. The blood pressure is low. You know the reason why. So it's very important to know these things. Now, what else can lead to polyuria? Give me all the answers, please. Por favor, let's hurry up. Yes?
What is the question?
What can lead to polyuria aside from diabetes mellitus? Addison's disease. Perfect. Why? What happens in Addison's? So what is the hormone involved here? So you have low levels of what? And therefore, what was aldosterone supposed to do? It was supposed to retain water and retain sodium. But because you have low levels of aldosterone, are you able to retain water?
No.
What happens to water? And what organ is involved here? Well, it's the adrenal cortex. It's called the aldosterone. But what is the target organ of the aldosterone hormone? Still the kidney. So that's the reason why it's under urinary system. Don't you understand what I'm trying to say here? What I'm trying to say, therefore, class, is that we're trying to integrate the things you've learned where? Anatomy, physiology, and here. What else? Give me more.
Low level of ADH.
Okay, what is that called? Low ADH from the, where it is produced, Tigran?
Hypothalamus.
Stored where, Tigran?
Posterior pituitary.
Oh my God, what did you get in my anatomy class, Tigran?
A.
Better prove to me, okay? I will get back that A. I will go to the registrar's office. So he is correct. It is produced in the hypothalamus, stored in the posterior lobe of the pituitary gland. And what does antidiuretic do? Retain water, just like aldosterone. But because you have low levels of this hormone, are you able to retain the water? Again, there is water what? Lost through polyuria. Does anybody know, including Tigran, does anybody, what is the name of this condition when there is low levels of ADH called?
Diabetes insipidus.
Okay, you are prepared for the nursing board exam, my friend. You could pass the nursing board exam, okay? Only for this question, though, okay? Diabetes insipidus. And that's the reason why people thought of this as the same. They're not the same. The hormone involved in diabetes mellitus is insulin from the beta cells of the islets of pancreas, of Langerhans of the pancreas. Well, this one involves the what hormone? ADH. But both of them manifest with what? That's the reason why people thought that they are the same, but they're not. What else? Give me more. Burn, of course. Is that going to be under polyuria?
No.
Can you think of any other thing that can lead to polyuria? Let me see in the list. Mellitus, insipidus, Addison's disease. Okay, Cushing's would be the same or opposite? There you go. Okay? So what is overload? Urinary system involving what? Well, technically, I would not put it under urinary. Cushing's is under what? Adrenal gland. There is a lot of water, what? Retention. Why? What is involved again here? Aldosterone. And what is aldosterone for? Water retention. So Cushing disease, there is high level of aldosterone. You have more water retention. What happens to your blood pressure? Blood pressure is high. Here, deficit, blood pressure is low. Okay, what else can lead to water retention? All patients with heart failure, liver failure, and of course what? Kidney failure. Are you following me? You have to think fast. You only give 90 seconds to answer the questions in the nursing board exam. What else? What about heart failure, which you have discussed before, right side and left? It doesn't matter. Whether it's right-sided or left-sided heart failure, it doesn't matter because why? It's still going to be what? Congestion. Congestive heart failure means you're retaining water, right? What about burn? Of course, you mentioned burn, right? What? It's the skin. Burn injury. Why would you have fluid loss? Because once the skin is no longer intact, the water will just ooze out. I have seen many burn patients. I used to practice medicine for 12 years. And when the burn patients are seen by me in the burn unit, I feel bad for them. Why? There's no skin to keep the water inside them. And not only that, they're dealing with two problems. Not only dehydration due to water loss. What the heck? Why did I put that there? Burn injury. How can I do that? How stupid of me.
So can I ask another question? Diabetes insipidus, is it overload or
Insipidus is
insipidus?
deficit.
Deficit.
But burn injury is definitely what? My goodness, how can I make such a big bobo mistake? I should go back to medical school and study medicine again. Yes. What can lead to fluid volume excess?
Okay, I have a question. If you have a deficit, does that mean you automatically have like acidosis?
Not yet. No, relax, relax. We're doing about fluids here. I don't want you to confuse about acidosis. Okay, relax, chill, okay? We'll go into that. Okay, anybody else who wants to tell me? Go, what is the opposite of Cushing's? Addison's. What is the opposite of diabetes insipidus? High levels of what? Increased ADH, which is the opposite. Now, there is no more time. Can I answer my own question? It's called SIADH, which means what? Syndrome of inappropriate ADH, which means you have high levels of what? High levels of the ADH produced by the hypothalamus, stored by the posterior lobe of the pituitary gland. So what do you see here? Do you see what I see? Do you see what I see? Everything is the opposite. Cushing's versus Addison's. SIDH versus what? Diabetes insipidus. Why do you need to memorize this? How many of you have a whiteboard at home? Why do I recommend that you do what I do? Become a clone of mine? I'm not saying I'm smart, but I'm just telling you, if you do what I do here, you do what I do, and then what? Erase this, and then what? Do it again one more time, and then erase it, and do it one more time. Do you think you'll forget? You have to think fast, believe me. Who do you think will need fluid replacement? Can you imagine if the nurse answers in the nursing board exam, I will give more fluids here, and you're gonna kill the patient? He's drowning in his fluids already. It's congestive heart failure. Especially when nurses make those IV fluids, give them. And if you do not know how to calculate or titrate the infusion rate, now of course you have these devices that are going to calculate. But what if there's a brownout and there is no power? And you have to manually calculate the amount of micro drops or macro drops? You could drown the patient because the fluid will go into the lungs, killing the patient. So to be very careful. Do you understand? Here, of course, but the nurse makes a mistake in giving what? Excess what? Diuretics. Example, Lasix, or whatever diuretic, hydrochlorothiazide. You understand? Instead of giving 5 milligrams because you're not good in math, you gave 50 milligrams. You understand what I'm saying? So you have to be good in math too, not only me. Doctors and nurses have to be good in math. Because if you give overdose, excess of Lasix, instead of giving 5, you give 50 because you forgot about the decimals, and patient will die. Yes, ma'am?
Why would they give Lasix to someone who's deficient?
Because like this, I'm saying it can lead to this.
Oh, I cannot hear.
Let's say I have a patient who is here. I give Lasix, right?
Okay, yeah.
And you converted the patient from overload to what?
Okay.
When the doctor orders Lasix, the presumption is that the nurse is going to follow what is ordered in the chart. If I said 5 milligrams per orem, TID, is it 50 milligrams? So what I ordered Lasix was for this condition. But because you are not good in math, you overgave Lasix Instead of this, it became this. The opposite. So we have everything there. Heart failure, liver failure, diarrhea is obvious, vomiting, burn injury, bleeding is obvious. What is that? Of course. Do you understand, class? Now let's go to acid-base disorders. Okay. It's simple. Why would it be simple? What does respiratory acidosis and alkalosis mean? It involves what organ? Respiratory conditions. So it involves the lung, right? So what's the normal pH of blood?
7.35 to 7.45.
If it's less than 7.35, it is what? The blood is acidic. If it's 7.45, the blood is what?
Alkaline.
Alkaline. PCO2 levels? HCO3 or bicarbonate levels? Are you supposed to memorize these values?
Yes.
Did I look at my notes?
No.
Am I going to take the nursing board exam? But am I ready to take that exam? Are you ready? Have you memorized these values? So, measure metabolic. Obviously metabolic, nothing to do with lungs. So, trachea, bronchus, primary, secondary bronchus, bronchioles, air sac, blood, contains the red blood cell. The red blood cell that came from the right side of the heart carries what? Carbon dioxide from the right side of the heart, right? The right side of the heart brings it to the lungs, and by diffusion from area of high concentration to what? Low, and that is called diffusion. Carbon dioxide was supposed to go out here, right? We exhale it, and we'll do inhale. Oxygen. Now, what happens if there is pneumonia or COPD? Will you have bronchitis, asthma, emphysema? Or when you have CRLD, which involves the lung. In pneumonia and COPD, there will be a lot of what? Secretions. Or in asthma, there will be bronchoconstriction and bronchospasm. What will that do to the airways? O for obstruction. If you obstruct or block the airways, will the CO2 be able to get out? No. The CO2 goes back where? To the blood. And does the blood contain plasma? And does the plasma contain water? So if you combine CO2 plus H2O, you form H2CO3, which is carbonic what? Carbonic what? Carbonic what? So what do you think this patient will develop? Respiratory acidosis or alkalosis? See? There is nothing that is hard in this class as long as you study and apply the knowledge of anatomy that you have learned in the past few months. So what do you think Dr. Gamo will tell the patient's nurse to do? Will I tell the nurse to suction the secretions? Will I tell the nurse to nebulize the patient to make sure that the mucus becomes dissolved? Will I tell the nurse to give a mucolytic drug? Lytic means dissolve the mucus, like S-carboxymethylcysteine. Will I tell the nurse to give the patient a bronchodilator? Will that help save the life of this patient? So the problem here is what? Hypo or hyperventilation? Hypoventilation. So therefore, if you were given a case scenario, you would expect the pH to be what? Less than 0.75. And what about the PCO2 levels? Greater than what?
45.
Because you are retaining what? You are retaining carbon dioxide, and therefore your CO2 levels will be high or high? Very high. Why? Because it was not able to go out. Why was it not able to go out? Because it was blocked by the mucus of a patient with pneumonia, a patient with asthma, bronchitis, and emphysema. If you know the pathology, do you know the treatment plan? And that is how you pass the nursing board exam. What is the opposite of hypoventilation? Hyper. I'll give you a clue. So you would expect the pH here to be what? Greater than 7.45, and the PCO2 levels will be less than what? 35. Why? When you hyperventilate, give me an example. A 16-year-old or 18-year-old female patient just broke up with a boyfriend, and this is how she will react. Oh my God, what will I do now? This is the CO2. Where is the CO2 now? Out. What happens to the CO2 levels in the body? It decreases. That's the reason why it will be less than what? 35. Is that what we call an anxiety attack?
Yes.
Is that what we call hyperventilation?
Yes.
So what do you tell them, the woman? Oh my God, I just woke up with my boyfriend. What will I do now? Find another boyfriend. It's called psychological counseling. When you become a nurse, are you going to be going to a psychologist too? Of course. Do you understand? Are we going to give them a brown bag?
Yes.
Why? You always notice I always follow up my question: how, when, and where, and what? Why? Yes, you, my dear. Why will I give a brown bag? Anybody in the first row? Yes?
So that way they go ahead and they retain the carbon dioxide.
Okay, look at me. Oh my God! My boyfriend broke up with me. What will I do now? Give you a brown bag and so the bag, the CO2 goes to the bag, and when he re-inhales, what happens? She will be able to re-inhale what? Good for her. Am I going to give this patient Valium? A sedative? Something to make her chill? Well, yes or no? Okay. What is the purpose of Valium or barbiturates? It's supposed to what? Sedate.
Why would you sedate?
Okay. Do you want her to die of respiratory alkalosis? You want to treat her, right? So do you think Dr. Gamo will order Valium for this patient? Shh. Okay, do you think I will order Valium? How many milligrams? If I want to save her life, 5 milligrams. If I want to kill her, 500 milligrams. And it's called respiratory overdose. It will cause respiratory arrest on the medulla oblongata. I'm just kidding, of course. We are trained to become medical experts. We know what to do. A patient who is having an anxiety attack, I can actually give an anxiolytic. Easily I can give what? Valium or any drug that will what? Relax them. And counseling will help, and a brown bag will help. So if the answer is giving Valium a good thing to do, the answer is yes, but with the right dosage. You understand what I'm saying? Overdose is not good. It's bad. The patient will stop breathing if you 500 milligrams of Valium. That's how they kill themselves. Do you understand? Do you understand? Okay, now, what is metabolic? There's no more time. Very simple. In metabolic, that has nothing to do with the lung. For example, this is what? What is found in your stomach? Hydrochloric acid. A patient who is vomiting, this is the hydrochloric acid in my stomach. Where's the acid now? In the floor. So what happens to my sexy booty? Will I become alkaline? Of course. So what is that called? Metabolic what? What do you think will be the pH? Greater than 7.45? Because why? I became alkaline. Do you understand? On the other hand, what about if I have diarrhea? What is found in my stool and intestinal pancreatic secretions? Perfect. And what is the first letter of bicarbonate? B. And what is the first letter of the word base? B. Is your bicarbonate ions, HCO3 minus, a base?
Yes.
Will that be found in your intestinal and pancreatic secretions?
Yes.
So when you have diarrhea, the base is on the toilet bowl. So what happens to you? You develop metabolic what? Acidosis, my dear. If you answer, you are in deep stool. And that is how people make mistakes in the nursing board exam, because they get what? Confused. A confused nurse is a dangerous nurse. Now, what is the correct answer therefore? If you have diarrhea, where is the base? In the intestinal pancreatic secretion, the base is out. The base is out. Alkaline out, I become what? And that is called what? Metabolic. Has nothing to do with the lung. On the other hand, if I vomit this acid, where is the acid now? On the floor, I become what? Alkaline. It's called metabolic what? A patient with type 1 diabetes develop diabetic ketoacidosis. Is that an example of metabolic acidosis or alkalosis? Oh my God, if you don't get that, I do not know what to do. All I can do is cry. It's already in the answer. Metabolic ketoacidosis is obviously metabolic what? And there is a reason for that. Type 1 diabetic patient, the levels of insulin is 0. The cell will have to utilize what? Fat as an alternate source of energy. And when the cell utilizes fat as an alternate source of energy, they develop or produce ketone bodies, which are acidic substances. And therefore, they develop what? Metabolic acidosis. The pH therefore will be less than 7.35. Do you understand what I'm trying to say here? Do you understand? You get it? Okay? The bottom line is, I will not go into compensatory mechanisms. If there's something wrong with the lung, the kidney will help. If you have too much acid in your system, the kidney will get rid of the acid through the urine and retain the base. If you have too much base in your system, like these people, right? What happens? You want to retain the acid, get rid of the base. You have a question, my dear?
Yeah, so when you're vomiting, why are you, like, you know how the doctors will prescribe, like, Gatorade? Why is that if you're out?
Oh, okay. The first topic a while ago was a fluid volume loss deficit. What does Gatorade have? Water. What does Gatorade have? Electrolytes. In vomiting, you don't only lose water, but you also lose what? So that's why I said that's a different topic. But they are related. So vomiting can lead to two things. Fluid volume deficit because at the same time it can lead to what? Metabolic alkalosis. Now, COPD and CRLD. Bronchitis is what? Pink puffer or blue bloater? What does blue mean? Cyanosis. The problem is where? In the air sac or bronchi or trachea? That's why it's called bronchitis. Remember, in your signature assignment due next week, what is the definition of chronic bronchitis? Coughing for how many years and how many months? I expect that to be in your answer. No answer on that, I will give you 0. No, I'm just kidding. It's up to you. Because that is the definition of what? Chronic bronchitis. Now, make use of your textbook as your main reference. Coughing for how many months? How many years? 2 successive. Successive. Do you understand? Perfect definition. And I hope you put everything about the pathogenesis, hyperplasia of the mucus gland or goblet cells, which causes increased mucus production, which blocks the airway. You understand? Treatment plan, very simple. Mucolytic to dissolve the mucus. Bronchodilators. Infection, treat with antibiotics. Is that reversible or irreversible? What about asthma? Reversible or irreversible? Why? The problem is in the bronchioles, where you have pulmonary smooth muscles. Can what? Bronchoconstrict or broncho what? Dilate. So you have what? What is this called? Can that be seen in patients with asthma? You see what I mean? So what do you give? A bronchodilator. And remember, this is a form of allergy, right? Remember? We talked about this in hypersensitivity patterns. And you can die because of that, right? The moment all the airways will close, what is the condition called when you do not anymore respond to the puffers and the bronchodilators? It's called diabetes what? This guy is ready for the nursing board exam. It's called status asthmaticus. Where do you get that, Mr. Tigran? The book. Of course. How many times did you read the book? Did you take down notes when you read the book? I don't see you taking down notes. So it's all here now?
I never take notes.
Ah, but let's sign up.
When I take notes.
The point therefore is that asthmatic patients give bronchodilators, right? Now, what about emphysema? What is the problem? Where? The wall of the air sac or alveolus or alveoli. What's the problem there? There is damage to it. What caused the damage to the alveolar wall?
There's no elastin.
Hmm?
There's no elastin.
Hmm?
No elastin.
What?
They lose elasticity.
Okay, okay.
That's what
And can anybody give me a keyword? Okay, I can answer my own question then. There is a deficiency of what? What?
Alpha 1 antitrypsin.
Did you not see that? Did you not read that? Please give me all that nice answers. What? Okay, deficiency of alpha 1 antitrypsin. Alpha 1 anti. Did you understand what that meant? I'm not trying to make you put you down, but please, whenever you read something, it's not just knowing it, but explaining why. That's the explanation that's very important to me. Why is a deficiency of, what does alpha 1 antitrypsin do? It protects you against what?
Proteases.
The proteolytic proteases or enzymes. What will the proteolytic enzymes do? Proteo means protein found in the wall of the air sac is destroyed by these enzymes. One of them is trypsin. So what does antitrypsin do? Fight against trypsin, which is the enzyme that attacks protein in the wall. So if you are deficient, you have nothing to protect you. The enzymes called proteolytic enzyme will destroy what? The alveolar wall, and you become a pink fluffer, and you will suffer the consequence of. How many of you smoke here? Continue smoking. It's good for you, and good for the business of mortuaries, and I'm just joking, of course. When you smoke, not everybody who smokes develops emphysema. Only those with an alpha 1 antitrypsin what? Do you understand? How many people smoke and some don't develop emphysema, but they may develop bronchitis? And not only that, is that going to be a risk factor for the development of lung cancer? Yes, it could be. The problem is that I don't smoke and I get and develop lung cancer because you're smoking. Yes, that's the reason why every time you see me in the parking lot, when you wave to me and those people smoking, hi, Dr. Gama, hi. I'm scared to die of lung cancer. You understand? Now, CRLD, anything that will compress the lung, would that be including pneumothorax and hemothorax? Remember, the pleural cavity contains pleural fluid for lubrication. Gunshot, how many of you been shot or stabbed in the chest? Okay, no one yet, okay. If you get stabbed or get a gunshot wound, there will be blood or air, it's called pneumothorax. If it's in the pleural cavity, it should not be there. If it's blood, it's called hemothorax. What does Dr. Gamer do? Insert a chest tube with a, this will come out in the nursing board exam, I'm particularly sure about this. We insert a chest tube. What will the nurse attach that to? It's called a pleurevac device. We'll measure the amount of fluid or blood coming out from the lung. Because if there's so much fluid or lung, blood there, which is not supposed to be there, will that compress the lung? Can the lung be able to expand? No, you die. The earlier you insert the chest tube, the better for you. Similar to, remember the word cardiac tamponade, where you have blood around the pericardium, you have to do a pericardiocentesis. Here you can also do, what's the difference with the chest tube and a thoracentesis? In thoracentesis, Dr. Gamo will insert a needle and a syringe to drain blood or excess what? Fluid. It's called pleural effusion. Could either be due to malignancy or cancer or due to infection, like pleurisy or pleuritis. But the best is always what? A chest tube insertion. Always. And you are expected to know why. Is that understood? Okay, that's it. So can you put everything in front, please? Good luck. I think I covered everything, right? There we go. For the electrolytes, just study them on your own. I think I told you to differentiate Bostex with other side, right?